Hey everybody, it's Misty and Andrew coming to you late thanks to a certain TV show that was on reruns on TBS tonight and I didn't want to stop watching them. Okay, everybody says you need to talk more. Tell them what you've been doing today.
Sitting in bed.
Morning, your arm. You want to show everybody?
I showed it last night.
This is how his arm has been all day. Exactly.
Well, not up.
Not up, but straight.
Out.
Yeah, he is practicing arm barring or clotheslining somebody, whatever you call this in football.
Goodness.
So for today, I just want to read a little tidbit that I found on the CERN website a few days ago. And this is under patient grieving and support, but it's kind of more about the caregiver and the patient too. So it says, the speed and suddenness of a brain tumor diagnosis can be utterly overwhelming for all involved. Normal routines, expectations, and hope for the future are often put on hold as you face difficult treatment decisions or learn to cope with the frightening symptoms. You may feel as if you're just getting by on a day-to-day basis. The grieving process often begins at the time of diagnosis. Brain tumors are unique in that they can cause cognitive deficits or personality changes. It is normal to mourn these changes, especially because it is a time when you most need the support of your loved one. Expressing this loss can be difficult, and people often feel guilty about having such feelings. It is important to remember that you can feel relief that the person is still with you, but at the same time, grieve the fact that they are not the same person you once knew. There's no right or wrong way to express or feel grief. It is an individual process influenced by many factors, such as your relationship with the patient, your role in their illness, spiritual or religious beliefs, and your past experience with loss. So, just to talk a little bit about that tonight, because Andrew was so young when he was diagnosed with his brain tumor, I don't know if he had any personality changes. Obviously, he doesn't have any cognitive deficit. He was just tested for homeschool and tested pretty much on target for all subjects as far as his age group goes. So there's no cognitive deficits. Personality deficits, I don't necessarily think, or personality changes, I don't think that they're changes in personality. It's just things that he has had to cope with has made his personality different than I think it would have been if he wouldn't have had to cope with certain things. Just as far as being different goes, he looks different. He looks special, and in today's society, different is not always as accepted as looking the same as everybody else. So that's obviously been a big part of our life. I mean, even last night going to Walmart, we were having the competition on who could look more weird at Walmart. But we're a very strange family.
Well, speak for yourself.
And he has a very strange mother, if we'll put it that way. Right? I'm not strange.
Yeah, baby, they've been watching your vlogs.
I'm not strange. Y'all can comment and say, I'm not strange. That girl, she ain't strange. Oops. Sorry, I was trying to brush dust off. So, we're strange. We're a different family. We're all different. We have our flaws as a family. We have our flaws as a mom and dad. And we have our flaws individually. But because of the factors that play a part in our life, such as our family, our friends, our support system, our church group and their prayers, other church groups and their prayers, we've managed to make it pretty unscathed this far. In 6 days, it's going to be Andrew's 8th year cancerversary. So we've been doing this for 8 years. And I think, as I've said before in a previous blog, he's only been off chemo for about 6 months of the 8 years. He has been continuously on chemo for 8 years. I don't know if I've ever, on the video blog, talked about his extensive treatment, but he was diagnosed in September of 2016. He had
2006. Baby.
Sorry, 2006. I'm tired. He was diagnosed September 16th, 2006. Later that week, he had his first brain surgery. It was a 10-hour surgery. Well, it was 12 total. He was back 12 total, but the surgery itself was 10 hours. And then they gave him 2 hours to go to sleep or an hour to go to sleep and an hour to wake up. So he was back he was under anesthesia for about 12 hours total that day. Then he had his second brain surgery the beginning of the next year, right?
Yes.
Then he had a spinal limb, or he started chemo. He had a full 30 days of radiation. And that at that point in time, it was the terrible chemo, the chemo that makes you lose your hair and your counts drop. And so we were constantly in and out of the hospital with different viruses. And then he had the full 30 days of radiation, and then we were off chemo, and we were told that, that they were pretty sure that, the tumors were gone and that we just have to keep an eye on it. So that was like in May of 2007. So then here comes the 6 months. This was our 6 months, I guess, calm before the storm, or between the storms. And then in August of 2007, he reoccurred in the brain and the spine. So they did a spinal laminectomy. When was it?
They did that in February of 2010.
Okay, well, they did the spinal. Well, okay, so we did another full round of 30 days of radiation to the spine, or to the lower back, the bottom of the spine. Basically, what they thought it was a piece of the original tumor fell down into the spine, but it was still alive. So they had to radiate that, and then he had a spinal laminectomy for that. And all in the course of this, he was having other little minor surgeries, like he had a G-tube implanted, because when he was on the first chemo that was dropping his counts, it was not allowing his brain to heal correctly. So he had some bruised nerves that weren't healing correctly. So he had a G-tube in, G-tube out surgery. He had a port in, port out surgery twice. So he's had his fair share of getting put under anesthesia, because the first 30 days of radiation, he was under anesthesia every single day. And then he gets anesthesia still with every MRI. So that also takes effect, because it affects your memory. And we don't know if, we always joke and say he has chemo brain because it's hard for him to remember stuff, but we don't know if that's a side effect of the chemo or the radiation to the brain or the anesthesia. I don't know that we'll ever know, because I don't know that we'll ever get another time where the chemo is not completely out of his system. Even this little break that we had where he wasn't on chemo, I don't think it was enough time for the chemo that he was on to get out of his system. So I don't think I don't think we'll ever know the answer to that. But it is what it is, and we make do the best we can with it, right? We use it to our advantage. Like when we forget to do a video blog, I can say, well, he's got chemo brain, he forgot. And I'm just strange, so I forgot. Anything you want to say about your journey? This is a good outlet for you. This is like your counselor. This is like Counselor Jason. You can talk about anything. Only 5 people watch it anyway, so it's not like many people are going to see it. No, nothing? Do you want to tell a joke?
I don't have one.
We'll grab your joke book.
Tomorrow.
Why is it in your room? You're supposed to be keeping it out here. He doesn't have a joke book because his Aunt Krissy has not been fulfilling her duty and sending him jokes. Tell her. Tell her.
What?
Tell her. Say, Aunt Krissy,
Mhm.
you better start sending me those jokes. So, we did our first port flush today. Not port, PICC line flush today. I was spazzing out about air being in the syringes where we have to flush it with saline and heparin. So that's about it. He hasn't really complained too much of pain, a little bit. He says he's not sure if it just itches or if it's painful. We took the sock off because it was applying a little bit too much pressure. We've got to find him some bigger socks. We'll do that first thing tomorrow. And tomorrow is September 11th, so I'm questioning doing the video, just to let y'all know ahead of time, the 5 people that watch this. I'm questioning doing the video blog tomorrow, just because I don't want to take away from the men and women who lost their lives to this day tomorrow in 2011. I think it's important to support and support any kind of cause that you're passionate about, and I think it's also important to remember other things than Childhood Cancer Awareness Month. We're doing this through September to bring more awareness to Childhood Cancer Awareness Month, or to childhood cancer, but there are other things out there going on in the world that are equal to just, it's not my passion. But I do think it's important to remember 9/11 and to honor those who lost their lives that day. So I'm debating whether or not we'll do a video blog. You'll find out tomorrow. How about that? So I guess that's it. Do you want to say anything? Do you want to call your dog up here so he can try to eat my face off? Roscoe. Andrew wants you.
So you went inside?
Yeah, he's right there. Get on the camera. Look, you're on TV. Well, you're not on TV now because you got out of the mic. Come here. Come here. Come here. Come here. We're too impatient, and he just don't like us. He likes Andrew. Andrew's his daddy. We've got this dog, and we've got a depressed dog right now. We're not really sure why she's depressed, but she is depressed. She's having nightmares and whining a lot, so we're trying to figure that one out. As far as everything else goes, just keep us in your prayers for the next 10 weeks. In 10 weeks, we're going to reevaluate everything, and if Andrew or if the chemo is working in 10 weeks, we'll do a port. So prayers for that. That's going to be a very long day because they'll do the MRI of the brain and spine, which takes about 3 hours. And that's with anesthesia. It gives them time to go to sleep and wake up. But the whole MRI itself is not 3 hours. And then while he's in the MRI for the brain and spine, they're going to do an MRI of his arteries to see if, or veins that the port goes in, I don't even know anymore, to see if it's blocked or not from his previous ports, to see if we can even put a port in at the top here, or wait, where am I? Here or here. Sorry, baby.
Okay.
So we'll know that after the MRI. Oh, look, he wants to snuggle with me. He wants to snuggle with his mama. So,
Does he go down with the
yeah, he won't get up on the couch by himself. So prayers for that. It's gonna be a long day. Then we'll have to wait for the MRI results to decide what we want to do. I think we're gonna try to get it all done in one day. Here, let me move Roscoe.
hard to get comfortable with two dogs?
Yeah.
With 2 of the dogs on
Yeah, there's Charlie in Andrew's lap. Yes, I have shoes on a shelf in my living room. Don't judge. So I guess until either tomorrow or Friday, we will see you. Keep the support going for Childhood Cancer Awareness Month. Remember to honor the people who lost their lives in 9/11, and keep just spreading the word, taking action, donate. If you want to donate and you don't know where, the CERN Foundation is very near and dear to our heart. So till tomorrow, keep wearing your gold.